So I'm Karina. Probably everyone knows that, but so I clearly suck at technology. So I couldn't figure out how to video so like you could see my computer screen because it was like one big glare, and then if that was in focus, you couldn't see me. So anyways, we're gonna do this old school. I don't really know. Okay. So my topic was healthcare organization and patterns. Very interesting. Um so these are the objectives. They are straight from the book. The biggest thing I think with healthcare is that a lot of people don't go to the doctor because they can't afford it. So what I think is really crazy about that is my brother went before like he switched jobs. So there was like a period of time where he didn't have insurance. So he went to the doctor, and they were like, if when he left, they told him that he owed this much money, and he's like, well, I don't have that today, I can't pay that. And they're like, well, that's fine, but we're going to add a fee. So it doesn't really make sense that if you don't have a certain amount of money one day, and then the next day they want to give you more money. So yeah, so healthcare should be within the reach of everyone. Kind of like I just said, it's definitely a difficult situation. So the book said that like the healthcare system has been changing drastically within like the last 35 years. So the main focus has been on getting healthcare to everyone, so there's less uninsured people, and also so that everyone can afford it. So nurses, obviously, healthcare, it's their job, so they have to be really knowledgeable about it, and they have to kind of keep up with the changes. Important challenges. So 200, sorry, this is complicated. $256 billion was spent on healthcare in 1980, and then it went up to 2.6 trillion, which is like 10 times as much in 2010. So there's lots of reasons. There's more and more drugs are coming out, more and more healthcare technology. Chronic disease is a big thing because you can't just go to the doctor, have something, like a broken arm, you go get it fixed, you get a cast, and then it heals and you're done. Like a chronic disease, you have to keep going and keep going. So then I just had an example of the cost of healthcare. So my dad had knee surgery in Rutland, and they wanted him to go to rehab afterward at the Pines. So, but they wouldn't let us, pick him up and take him in our car. So they had to take him in the ambulance. So the ambulance ride from Rutland Regional, literally across the street to the Pines, was like $400. It was insane. So, healthcare is definitely a huge, crazy expense. So the Affordable Care Act of 2010 was passed after like 20 years of trying different strategies to kind of reduce the cost of healthcare and make it more available to people, which I kind of already just talked about all of this. So it's like showing up backwards in here. So managed care. So in the early 1900s, there was a fee-for-service approach, which was families and patients or clients would pay the doctor or hospital directly for the services they used. Early 1980s, prospective payment system. So a fixed fee was kind of paid to the hospital according to like there was like a certain rate for each diagnosis. So it was like a set rate, if you had diabetes, they got this much, kind of like that. So then capitation was employees would pay a set fee for each member, and the fee didn't increase or decrease based on the type of care. So you could go in for a cold, and you could go in for surgery, and it would be the same, and you could have nothing done and the fee would still be set. HMO plans is health maintenance organization plans. So it's like an annual payment made, to a group of providers who deliver like um, the whole field of care. So it's like all under one plan. And then the PPO is the preferred provider organization. So it's a certain group of doctors that you have to see if you're under this plan. So it costs the insurance a lower amount of money, but you have to see one of the doctors that is on their list. Case management. Sorry, this is painful. So a case manager is kind of like an advocate for patients. They help them understand their disease or diagnosis, what they have, what they can do to fix it, kind of like understand it. They guide the patients through the healthcare delivery process. So they're going to help them set goals and then achieve the goals. So case managers are very effective, but they're kind of expensive, so they don't, not every patient needs a case manager, I guess. So the main reasons that you would have a case manager is if you have like really complicated and expensive diagnosis, then you would have a case manager to kind of like keep things on track for you. There's also receive care from multiple providers. So if you have a lot of doctors and stuff, then you're going to need, you won't need, but a case manager is kind of going to be really helpful to, like I said, just keep everything straightened out. Disease management. So it's a system of coordinated healthcare interventions and communications for populations with conditions in which patient self-care efforts are helpful. So the goal is mainly for patients with chronic disease to support them. So they're going to learn how to take care of their disease to prevent like exacerbations or recurrences or kind of like worsening of their condition. And their research that was done on this said that the disease management programs helped with the patient care, but there was no there was no information on whether or not it helped with cost. So it helped with care, but there was nothing about cost. Evidence-based practice. I don't know about you guys, but loved this class. So it's used to reduce the amount of time required to integrate new healthcare findings into practice. So it's really important just because things change on a day-to-day basis. I've encountered in clinical things that we were taught in nursing school and that nurses and doctors are already doing differently. So that's why this is really important. The example that the book gave was hydrogen peroxide. So I still, to this day, because I like subconsciously don't think about it, but if you like scrape your toe or you have a cut, you're gonna like pour the bottle of peroxide on there until it's like done foaming and you're like, oh, all the germs are gone. So apparently it does kill the bad germs, but it kills the good stuff too. So evidence-based practice has suggested, or that soap and water is like way more effective. Nursing shortage. So the most recent shortage began in 1998. So there will be an estimated 1.2 million job openings for RNs by 2020. And then the shortage is going to grow by up to 260,000 by 225. So nurses are clearly wanted everywhere. After going through nursing school, I kind of understand why there is a shortage. So the biggest thing here is retaining your nurses is just as important as recruiting new ones. So things that make nurses stay are having support from their coworkers, from their supervisor, from their boss, autonomy, and then opportunities for promotions. I know in my my job right now, I'm an aide I work for the visiting nurses. Um, but there's, I'm kind of at the bottom, so I can like move up. But some jobs, once you're a nurse or once you're kind of like at the top, there's no room for improvement. So, nurses want to find a new job, they want to go somewhere else. So then the things that make them um, leave would be a high workload. Because there's a shortage of nurses, you're going to have nurses working like mandatory overtime all the time. So that's one of the main reasons why nurses leave. Magnet Hospital. Rutland is a magnet hospital. So, a magnet hospital recognizes the characteristics that influence a positive work environment on nurse retention. So, they're magnet hospitals because they have a really good rate of keeping their nurses once they have them. So, there's a high nurse satisfaction, there's like low turnover, and there's not really always a lot of jobs available just because of the low turnover. So, it can be a really good thing when you have a job at a magnet hospital, but it's, probably harder to get a job there because there's not a lot of openings. Patient safety. So, tens of thousands of Americans die each year because of medical errors, which seems really scary because nursing is like the most trusted profession. And I kind of feel like my own personal, like when you go to the hospital, like nothing bad can happen to you because there's people there that can fix you, which is totally unrealistic because people die and there's things that can't be prevented. But this is talking about, simple medical errors. Medication, though, is the example they gave in the book. They did a study on med passes, and when they did this study, they found that the average med pass took the nurses like 15 minutes. And within each one of the med passes, those 15 minutes, they were interrupted at least once. So, big thing that we were taught is to never interrupt nurses during a med pass because that's how bad things happen. So the biggest thing here is communication, and the importance of safety is not only for the patients. You have to obviously be safe for them, but you also have to evaluate your safety and see what you're doing wrong, what you could be doing better. And this is why the Joint Commission has a national safety list of goals. And based on these evaluations, they revise them every year to make them better. Total patient care. So this is like one-on-one with a nurse and a patient. It's also called the private duty model. So a lot of nurses prefer this method because you get to work with your patient one-on-one. You know them, you know what they want, what they need. And it said a lot of like communication time wasted on like communicating was saved just because you were one-on-one with this patient. And then some nurses didn't like this because they felt like their skills were being wasted on something that someone with less skill could do, which, I mean, kind of makes sense, kind of doesn't. But, yeah. Functional nursing. Nursing care is broken into a series of tasks performed by many people. So the biggest downfall to this was like fragmented care. So the nurse would be assigned to do, nurse things, doctor would do things, but there would be things that would be missed because they didn't fall under a certain category. So like no one was kind of responsible for the entire patient, just kind of parts and pieces. And then another downfall was that there wasn't nobody kind of like addressed their psychosocial or spiritual needs, just because again it didn't fall under like a certain category. Team nursing. So a team leader is in charge, and they kind of set the goals for everyone else. So you're gonna have like a team leader, then you're gonna have like some LPNs, some aides, LNAs, and you're all gonna have a purpose. Communication was another big thing with this. It's really super important. They have like team meetings all the time. So it allows the patients It allows the nurses, the ability to know their patients well enough to kind of know what sort of care that they will need. Um, and then the downfall is that when the staffing is short, care can sometimes be limited just because, staff is limited. Primary nursing. So, a nurse plans and directs the care of a patient over a 24-hour period. So, this was kind of designed to reduce the fragmented pieces between, change of shifts. I know there's a lot of times you just don't have time during your shift to finish up something, so you would kind of tell the next person to do it. So this kind of eliminates that. You get more done. It's also called relationship-based nursing. And so the team nursing kind of took the RN away from the patient bedside, and they were kind of in charge of making the schedule and delegating. So this kind of, in a way, puts the nurse back at the bedside of the patient. Transitional care. So this is kind of when they go from the hospital to home or to a nursing home. There's different things. The first one is transitional care model. So this provides comprehensive in-hospital follow-up care plans. And then care transitions intervention teaches self-management and communication skills to patients and caregivers so they can coordinate care, so kind of everyone is on the same page. And then re-engineer discharge provides patient education. They do medication reconciliation. They make follow-up doctor's appointments, and then there's also a discharge plan. So nurse work assignments. Sorry. So obviously it's going to vary depending on the patients that you have, how many you have, what their diagnosis is, how much care they need, condition of the patient, architecture of the unit, how experienced your staff is, things like that. So the major issue with this is that patients fluctuate day to day, minute to minute, hour to hour. And also it mentioned in different seasons, there's, more patients. Obviously flu season, you're going to have more patients, but so it's kind of hard to know how many nurses you're going to need. Because we've had clinical assignments where we come in and we have a patient and then we go on lunch and they're discharged, so we come back with no patient. So that's kind of the issue with the NERC course assignments. So it says nurses have tried a variety of approaches to anticipate the number and qualifications of nurses who will be needed for a specific period, which isn't easy, as we all know. And then work assignments need to ensure a positive work environment for employees, which obviously is teamwork. Teamwork is a big thing in nursing, and that's one thing that I've noticed with I personally had a bad experience at Porter when I had my clinical there, just because the nurses, I felt didn't like student nurses. They weren't happy with us at all. You kind of felt in their way. You were afraid to ask questions. But I've been at Dartmouth for peds and OB, and they're wonderful. Totally different. They make you want to be a nurse. They're extremely helpful. There's no stupid questions. There are some things you're afraid to ask, where you find stuff, but for the most part, it's been an amazing experience at Dartmouth. So, nurse work assignments. The end. Time to graduate.